Hi, my name is Dr. Manali. I am with Legacy Physical Therapy, and today I want to drop in and talk about the top 8 misconceptions that people have about pelvic floor physical therapy. I feel like pelvic floor physical therapy has become the new buzzword. Everyone's talking about it, it's all over social media, but there are a lot of misconceptions that people have, whether they kind of don't exactly know what it is, know the purpose of it, or feel like they're unsure if we can actually help them or not. So I wanted to drop in and really talk about the top things that we tend to hear and clear up some of those misconceptions and set the record straight. So the first one I'm just gonna talk through is only women that have had babies need to see a pelvic floor PT. Although we do strongly believe that all women that have had deliveries should be coming into a pelvic floor PT for a full postpartum screening to address anything that occurred during the pregnancy period or in that postpartum period, and that we don't want them to develop any issues later on in terms of leakage or muscle weakness and things like that. We see tons of men and women that have come in and that have never had any children. We commonly treat conditions such as bowel or bladder leakage, pelvic pain, and these are not just for women that have had babies. This is something that is commonly occurring for women and men that have never had children. So don't let that misconception stop you from coming in for pelvic floor PT. We can help you with these issues. The second one is that pelvic floor PT is not for men. This is not true. We see all genders of patients here at Legacy Physical Therapy. While it is true, I will say that we do see more women than men. We certainly see plenty of men coming in. The most common issues I would say that we're seeing men for is post-prostate surgery rehab, any bowel or bladder leakage, urgency, or constipation. So don't let that stop you from coming in. We can help you. The third one is we commonly hear, I have bladder leakage, I've tried kegels, they didn't work, so what can pelvic floor PT do? So bladder leakage can be a result of several factors. Part of it can be muscle weakness that's going on, so kegels may be appropriate for that. But a lot of times we actually tend to see that people have a lot of muscle kind of tension that's going on and poor coordination between their brain and their pelvic floor muscles. And that's what's actually contributing to their leakage. And kegels is not going to be good for that. Kegels can actually irritate those muscles. And so based on your full evaluation, we really talk through and provide a lot of different techniques to train your pelvic floor muscles to stop bladder leakage issues from occurring. Rarely, I'd say it's kegels, like just kegels, the solution. The fourth misconception is that kegels is the only exercise that can help the pelvic floor. This is highly dependent on your body, the state of your pelvic floor muscles. Sometimes kegels, like I was saying, can do a lot more harm than good. So we find that a lot of our patients are coming in with a lot of tightened, irritated muscles, and they're doing kegels, and it's not what they need. They need to first relax those muscles, get that high kind of driven pelvic floor muscle tension released. Then we'll really jump into more coordination training, strength training things. The fifth common misconception that we hear is, I've been told that I have a prolapse and I need to do surgery. So here at Legacy Physical Therapy, we strongly believe that regardless of if you're planning on having surgery, if you already had surgery, those pelvic floor muscles need to be strong and fully functional for you, regardless of surgery or not. Since every individual's pelvic floor is different based on your level of prolapse, research has actually shown that pelvic floor PT can be really effective in treating this and possibly not even needing surgery depending on the level of prolapse that you're experiencing. The sixth common misconception that we tend to hear is that pelvic floor physical therapists don't know how to do a vaginal or rectal exam. This is actually untrue. So after graduating from physical therapy school, pelvic floor PTs have to undergo additional training. That includes training on how to perform a safe and effective internal vaginal and rectal exam, looking at the muscles and the nerve function, all the different components that go into a full pelvic floor exam. So based on your symptoms, we thoroughly go through this examination process with you. We ask consent throughout that exam process. And there are a lot of different ways that if you're not comfortable with an internal exam, we can assess things externally. So don't let that stop you from coming in. A vaginal and rectal exam is actually the gold standard for assessing the pelvic floor muscles, though. The seventh most common misconception that we hear is that bladder leakage is a normal part of aging. So why do pelvic floor PT? Bladder leakage in the elderly is common, but it should not be considered normal. I'm going to say that again. Bladder leakage in the elderly is common. It should not be considered normal. We treat patients all the way from young teens all the way into their 90s and hear about and help them with their bladder complaints. So Don't let something like bladder leakage, thinking it's normal, stop you from actually treating the issue, because it's not normal and it shouldn't be. It should not be something that you're having to deal with. The eighth most common misconception is that painful sex is normal and there's nothing that can be done about it. We hate to hear this. Sex should not be painful. It should not be considered normal. There's plenty that can be done for this. So there's often sometimes a muscle or a nerve component that is causing these symptoms, and that can be treated via pelvic floor physical therapists. So that is the most common misconceptions that we hear. If you find that you're dealing with any other pelvic floor issues, or previously felt like you weren't appropriate for pelvic floor PT, you may be surprised that we can help. So come and talk to us. You can call the clinic, set up a free discovery visit to talk to us one-on-one to really dive through your issues and see how we can help you with your pelvic floor issues. So we hope to hear from you. Have a good rest of your day. Bye.